today to our session, Final FDA Guidance on how to complete the Form FDA 1572 adequately and accurately. This is a very hot topic and one that I think a lot of people are curious to know how to properly fill out this form. So this session should be a great one, and I look forward to your questions that you have. So just a little bit about me. I have been a clinical research professional now for a little over 24 years. I started out as a research nurse in an academic center, followed by working as a project manager in a CRA for both a sponsor and CROs. I enjoy training and sharing my experience as well as getting knowledge from you as clinical research professionals. It's always nice to hear your questions because your questions help me in developing my skill set as a trainer. So with that, we'll go ahead and get started. Okay, so before we get started, I'd like just to give a disclaimer here regarding our course. And this course is not intended to provide legal advice. And we're going to be going over information that we've received from the FDA guidance document, which you've received that particular handout in your materials from Barbara Potter. We're looking at the strictest rule, which is recommended when regarding use and completion of the Form FDA 1572. Also, we are going to be held accountable to the strictest rule. And so when we're looking at this, we're looking at both the regulations and also our SOPs, also looking at contract and local laws. So when we go through some things, you may say, well, the FDA guidance says this, but we're having to update the 1572, say, when we have a change of address. So we're going to look at this a little more closely during today's session. And our objectives for today's session are to review significant guidance content, also to detail form completion for clarifications for key debated sections. So there are several sections where there's some debate as to if you should list, say, for example, a study coordinator as a sub-investigator. So we're going to address that issue. Also, to assess impact on our current practices, as well as review case studies of documented deficiencies of the form and warning letters and map the guidance to other FDA initiatives. So here are some additional references that I put on the slide. So we have two references at Barnett that you may wish to look at closer. We have a Form FDA 1572 book that's there shown on the left, and then we also have an updated GCP question and answer guide, and we update that annually. So our new edition just came out. So that may also be a good reference for you as well. As an introduction, why was it that we needed to have some guidance or clarification on how the Form FDA 1572 is completed? It's been around for a long time, but so many questions have come into the FDA on how to complete this form. Also, too, we have more studies that are being conducted outside the U.S., and there's been some question, do investigators outside the U.S. need to complete the Form FDA 1572? And of note, in February of 2008, Norway actually became the first foreign government to instruct clinical investigators not to sign the FDA 1572 document. So we're going to talk a little bit about why the form was not completed by some clinical investigators. Also, too, looking at stakeholders and how they have difference of opinion on how to accurately and adequately complete the form. And when we're talking about stakeholders, I'm talking about sponsors, clinical investigators, and then the IRB. So, for example, on the form itself in box number 6, there's question, well, who should be listed as a sub-investigator? And then also, too, there's question, do we always need to complete a 1572 for all of our clinical trials? So we're going to talk a little bit about when you do and when you do not use the form FDA 1572. So in May of 2010, the FDA had a final guidance document that was published. And I'm going to show you this document here. And you have a copy of this, and it's a very nice document. And what I like about it is it actually goes through questions and answers, and we're going to go over this in detail today.